Welcome back to part 2 of our Ask the Dietitian episode of the Exam Room Nutrition Podcast. I'm your host, Colleen Sloan. I'm a registered dietitian and pediatric PA. Now, if you didn't already listen to part 1 of my discussion with Dane and Julie, go check out episode 56. Because if you'll notice, today's episode is a little different than my usual style. Today, you get to enjoy the final part of my discussion on cancer nutrition, where Dane asks Julie all about nutrition strategies for survivorship. He asks questions like, what diet is the best to prevent cancer recurrence? How much alcohol is too much? Are certain types of alcohol better than others? And is soy bad to eat for someone who had estrogen-positive breast cancer? As a quick reintroduction, Dane is a board-certified physician assistant who works in hematology and oncology, and Julie is a registered dietitian in oncology nutrition. Now, if you like this format to some of my podcast interviews, can you send me a text message just letting me know? Wait, a text message? Yep, you heard that right. Just open the show notes and click on Send Colleen a Text Message and type your message to me. I would absolutely love to hear your honest feedback about this format to my podcast. Also, if you're a medical provider who would like to come on to my show and ask a dietitian your nutrition questions, there's a form you can fill out in the show notes below. All right, well, get comfy, my friend, and enjoy the final part to my discussion with Dane and Julie. Dane and Julie, welcome back for our part 2 of our oncology nutrition segment. I'm so excited to have you guys back on. Our first segment was a wild success, and I got a lot of really great reviews and comments from it. So Dane, thank you so much for coming with your questions, because this is just so helpful for people who are in the field of oncology and getting those nutrition questions that their patients are asking. So Dane, I would love for you to just open up with your first question for Julie to answer.
Yeah, thank you for having me. And I'm ready to try to stump Julie this time. I couldn't do it last time, but let's see if I can do it this episode. This is near and dear to my heart because survivorship is huge and patients go through so much during treatment and we try to get them through it. They beat it, they beat their cancer, and now they're at a point where survivorship, which you would think, oh, they're happy, they can live their lives, and it's not necessarily back to completely normal. It's a new normal, and hopefully it's close to normal as their normal was before they were diagnosed. But I find that a lot of patients have this fear of recurrence. And this fear of recurrence, I feel that is just as bad, in some cases worse than being diagnosed with cancer. Because now that every day they're thinking, well, is this cancer going to come back? What am I going to do? If it comes stage 4, that's it. So what do I do? And I see a lot of patients for follow-up and they ask me, what can I do with my diet, my lifestyle that I can best reduce the chances of cancer? And at first I was very scientific. I said, cancer just happens spontaneously. You can't really avoid it. But at the same time, there are ways that you can try to minimize it based on data. But then as I went on my career, I realized that if patients have something to hold on to and have a goal, and that goal is going to help them minimize their chance of recurrence, it's going to make them feel better. It's going to make that fear of recurrence a lot less than it would be if they didn't have anything to do or have any goals. So my first question would be is there a general diet that is the best to prevent any cancer recurrence?
Well, so I don't use the word prevention because it's problematic. But as clinicians, as public health providers, we can use the term prevention for a population. But for an individual, I'm always like, there's no guarantee. I mean, we all know people who did everything right, they still get cancer. We know people who do everything wrong, they don't get cancer. I don't want anyone to get cancer. But there's no guarantees, but we certainly know there are things that can put the odds in your favor. And so I like that term risk reduction, and that healthy eating is a piece of that, but is not the entire, lifestyle piece. So if somebody is post-treatment and they are not able to eat well, they can, work on the other things first and just kind of get their rhythm of eating back before they get on board with a nutritious diet. But we have data showing that healthy lifestyle can reduce risk of recurrence. We don't know which people, again, what's going to do that for, but there are some really common, I say common recommendations or common threads across healthy eating guidelines that I push for people. So I looked at a variety of different healthy eating plans, the anti-inflammatory diet, the Mediterranean diet, the DASH diet, the My Plate from the USDA, and the New American Plate is from the American Institute for Cancer Research. All these are great healthy eating plans. So if somebody wants a really specific, like multiple categories of how many foods to eat, those are kind of the 5 that I recommend. But what I did was I looked at what they all have in common, and that's what I work with people on. And that is, first of all, eating plenty of fruits and vegetables. So generally, that's 4 to 5 cups a day of fruits and vegetables. That's combined. If people like more vegetables, they have more vegetables. If they like more fruit, they can have more fruit. I encourage them to get protein regularly throughout the day. They don't need a ton of protein, but it's better if they can give their body protein like at meals and snacks rather than loading all up just at dinner time. We recommend to get beans, nuts, and seeds daily. Even if you are a meat eater, it is fine to consume moderate amounts of meat and dairy. They're very efficient forms of protein. If you don't want to eat meat and dairy, that's also fine. I call it a choose your own adventure. But the data does not suggest that eating a vegan or vegetarian diet is any better for you than eating a mostly plant-based diet with some meat and dairy. So I kind of leave that up to the patient. Okay, so we talked about fruits and vegetables. We talked about beans, nuts, and seeds being important for everybody. Now, vegetarians and vegans obviously eat a lot of them, but meat eaters need to eat a serving at least of beans, nuts, or seeds every day. That helps them build their fiber for the day. And then fluids, they need 8 to 10 cups of fluids a day, ideally water or cucumber water or lemon water. Nothing too fancy. And whole grains is when we're talking about carbohydrates, we want nutritious carbs. So that's starchy vegetables and whole grain most of the time. And that's kind of the base. So I tell people you can follow some other plan, which most people actually don't do well with, or take these sort of categories and figure out how to create your own plan with the foods that you know you like. And it should not be super complicated and should not be super restrictive. It should still allow people to eat the foods that they love. I also kind of encourage what I refer to as like the 80-20. So 80% of the time you're choosing foods because they're going to nourish your body. And 20% of the time you give yourself the freedom to eat whatever you want just because it tastes good. So that's overall general, like survivorship. Now people have eating challenges coming out of treatment. We might not be able to get there for 6 months to a year, but that's kind of what we're looking at long term as the evidence-based survivorship diet.
Julie, I love that you mentioned your 80-20 rule because dietitians are so good at this aspect. Although we are the nutrition professionals, we also remember that food has more purpose than just nourishing our bodies. It's easy to forget that food is celebratory, that food is cultural, that food is comforting. And sometimes we just eat a food because we want to eat a food or because it's someone's birthday or because it is part of a ritual in our culture. And influencers completely disregard this when they tell people to follow really strict diets or completely eliminate certain foods, is that we still have to respect the humanness of eating and why we eat. And it's not just about nourishing our bodies. Although, yes, it's super important and patients are asking us about those things, we still have to remember and allow them the freedom to have a little bit of wiggle room within their diet and to still say, hey, yeah, you can still enjoy those foods and not feel guilty or shameful about it. So I love that you went there and mentioned that too. And Dane, great question. So what is your next question for Julie?
Talking about foods, let's talk about more specific recommendations. So get a lot of questions about what are healthy meats. Are there certain types of meats, the white meat, the lean meats versus the red meat? What are better types of meats than others during survivorship?
So I do recommend fish twice a week, and that's just generally whichever kind people like. The easiest versions of fish are like sardines in a can or tuna in a can, but maybe not the most tastiest depending on people's cultural preferences or taste buds. So any type of fish, I think, is a great way to get protein and a meat source that's very nutritious. The ones that have the most research in terms of you wouldn't want to have too many is your processed meats. Again, I am not somebody who says you can never have it. The guidelines around processed meats are not particularly helpful because they're basically like limit, and there's no threshold that they've found is like a safe level. So I just tell people when we're talking about processed meats, do you have ones that you love that you want to incorporate? How often are we having those? Can we keep it to, is it once a month? Is it once a week? We don't want a habit of eating processed meat. So it's a difficult line to draw for people. They want me to draw lines for them in terms of what's okay and what's not okay. And when we don't have the evidence, I can't answer that for them. And I'm also not somebody who's going to tell them you should never have bacon. So I think we all run around with risks in our lives, and it might be worth it to you, like to the point of why are we eating healthy? Like, why do we want a healthy survivorship diet? That's so we can nourish our bodies so that, I think most importantly, you just feel better. Like, that's what we're going for. From day to day, you will feel better. It's not just about longevity of life. We're talking about you'll feel better. You'll have better energy. You'll have better digestion when you eat well. But the other thing is, yes, if we're talking about reducing risk of recurrence, why? Because you have things you want to do in your life and your nutrition plan needs to support that. So it shouldn't take away from that. So if part of the things that you want to do in your life is like pass on your family recipes to your family members and they include processed meats, that's okay. If you can find a substitute, fine. If you can't find a substitute, don't worry about it. So finding that balance with some of the foods that, quote, we limit. So those are the processed meats. That's sausage, bacon, deli meats, that type of thing. Not to have them too often. The meats that have more saturated fat in them. So I tend to encourage people to eat more of the fish, like make a habit out of eating fish 2 to 3 times a week, have fish. Chicken is fine. And then less often you're having red meat and then minimizing your processed meat.
So our last talk, we kind of debunked the whole eating sugars as a big no-no for feeding cancer or being a bad thing during treatment. Now, what about in survivorship? Eating especially a lot of carbs, processed sugars like high fructose corn syrup. Now, is that different, or is that the same where it doesn't really matter in survivorship?
Same as what we would tell the general public. So certainly we don't tell the general public to just eat all the added sugars they want, because the general public has a little bit of a problem. They have a little bit of a problem over consuming the simple sugars. Like, they treat themselves a lot and they are not creative about how to make their foods taste good. So sugar's fine in moderation, and it is very difficult right now to find moderation because in our culture you have either people who are basically over consuming added sugars, and then you have the like carb Nazis who refuse to eat any carbohydrates or added sugars. And it's like, hello, we can find a happy middle, but that's not the American way. The American way is like all or nothing. But I'm here to tell you, we can find a middle ground. And so some sugar is perfectly fine, perfectly healthy. I mean, sometimes adding sugar to a nutritious food makes you want to eat more of it, and that is called a win. And that's sort of why we want to use added sugars, is to help basically like get us to eat the nutritious foods. It's a nice partnership. So what I tell people about sugar is that when it comes to beverages, sugar sweetened beverages should be a special treat. So that's like a once a week thing. In the South, it's sweet tea, or if it's the soda. I'm fine with you drinking a regular soda, not every day, but like once a week is fine. So finding that balance with the added sugars and mostly eating whole grains and fruits and starchy vegetables and those healthy carbs. I've had people in my classes who want me to define, they're like, no, but really, how much ice cream is okay for me to eat every week? And I'm like, I cannot answer that for you, because that just goes into like, Well, how often do you currently eat ice cream? If it's every single night, we might want to talk about why. Why are we having ice cream every night? Like, are you actually just hungry and you need to maybe add a snack into your night of more nutritious foods? Can you use that ice cream as a way to get more nutritious foods? Like bananas and nuts are pretty delicious with ice cream. So ways to just figure out, hey, what is our relationship with sugar? Sugar's neutral, just like any other ingredient. There's nothing good or bad about it. There's just that, how is it helping me meet my nutrition goals, which our nutrition goals should support our life goals. Sugar's not evil, but we do need to find the right balance.
I actually love that you had mentioned that sugar helps food taste better and helps us eat more of the nutritious foods, because I'm kind of in the picky eater space working in pediatrics. And I will suggest to parents all the time to give kids like a banana with Nutella or strawberries with a little sprinkle of sugar. And sometimes their eyes bug out at me that I had said like, oh my gosh, you're going to tell my kid to eat sugar with their fruit. And I'm like, yes, because that little sprinkle of sugar does not negate the benefits of your child eating a cup of strawberries every day.
Yes.
I promise you, it's not removing how nutritious those strawberries are. And I'm not worried about the little half a teaspoon of sugar that maybe you sprinkled on that strawberry. And I think as a culture, that's hard to get around. And you're so right. We are all or nothing when it comes to carbs or sugar and in that space. So I think that's a really helpful thing to unpack.
Like, if those strawberries were super fresh, like ripe off the vine, you would eat them with no sugar needed. But sometimes we buy food at the store that is not the ripest. And it needs a little bit, like, it doesn't have the sugar that it would naturally have as the most delicious strawberry ever. So you've just like, hey, made it edible. And yeah, I'm totally with you.
Another thing that you mentioned that dietitians are really good at, and most of my guests talk about, is that add-in approach, where you mentioned that with the ice cream. And I want to make sure my listeners heard that you have to work with your patient. Number one, find out why we're having ice cream every night. But number two, if it's ice cream is their non-negotiable and they really just would like to have something sweet at the end of the night, what can we add in to add more nutrients to that ice cream? We'll keep it that example. And you had mentioned nuts and berries or bananas. So you're adding some fruit, some fiber, a little bit of protein, a little bit of fat. And it is actually a little bit more of a complete, well-balanced snack. And hopefully over time, you can suggest, can you put in more of the nutritious things like the nuts and the fruit and a little bit less of the ice cream, and over time get used to eating maybe just a dollop of ice cream with a whole bowl of fruits and walnuts, right? So you're still working with the patient where they are. And I think that is lost in nutrition education, is we tell them no ice cream at all. And we know that restriction leads to binge eating, and that never works for anybody. So if you can just kind of work with them and meet them over time, it's more helpful.
And I was going to just add in that, like, what I think a lot of practitioners, especially if you're not in the dietitian or nutrition world, you don't realize that a lot of these people, especially women, are coming in with disordered eating problems pre-cancer. And that oftentimes the cancer diagnosis and this need or want for control can like bring back an eating disorder or kind of push people from disordered eating into eating disorder. And so you as much as possible, helping them see that moderation zone, that there's no black or white or clean or dirty, is necessary to help them long term. Because like you said, Colleen, if we go into super restrictive, it's just going to end up with like binge on the other end, which is long term far worse than just like, hey, let's just make a few positive steps here.
Such a good point. And you're so right. I get the clinician brain sometimes, and you don't think about that a lot. Are they coming in already with some disordered eating habits and patterns that now this cancer diagnosis and all these restrictions are just fueling that? So I think that's a really important conversation that clinicians should pick up on. All right, Dane, what else do you have for Julie?
Okay, let's talk about specific cancers like estrogen positive breast cancer. So that means that their estrogen's feeding their cancer. And there's a lot of talk about soy in their diet. So is it safe for all these patients to eat soy going forward as a survivor?
Yes. So the myth is that there's some kind of plant-based estrogen that can be found in food that somehow if you eat it, it's going to fuel an estrogen positive cancer, which again comes to my favorite answer, which is that's not how it works. First of all, plants don't grow human estrogen. Like that's just it. So when people hear or are told, oh, there's estrogen in that food, that's not human estrogen. It's just like another chemically similar component to estrogen. It is not the same as human estrogen. Besides the fact that the amount of, quote, plant estrogen that would be in any food that you eat is so minuscule compared to the amount of estrogen our bodies just produce endogenously, even men. There was concern, legitimate concern around soy being a source of phytoestrogens. Originally, it was discovered because it was good for your heart. Well, phytoestrogens, which phyto just means plant, they are actually good for us. And there's lots of data supporting soy foods and even data studies done in human breast cancer survivors that says soy is good for you. I do help kind of draw the line for people that when we see an overconsumption of phytoestrogens, it's only when people are consuming like concentrated versions of soy. So that would be supplement versions. I'm not a fan of people consuming pill form of nutrition anyway. I want them to get their nutrition from foods as much as possible. And so I do recommend staying away from supplements in general and soy supplements, any soy powders. So again, soy is totally fine. And I much prefer that you eat soy foods and then limit your processed versions of soy.
So I want to hone in right now. So if a patient says, is soy milk okay? What can the answer be?
Yes, great. It's actually, from a standpoint of milk alternatives, soy is the closest nutritionally to cow's milk that there is. And the other plant-based milks are really pretty inferior, if you ask me. So I am a fan of soy milk for people if they want a cow milk alternative.
Great. All right, Dane, what else do you want to know?
So let's talk about alcohol. That's a big question I get. So
Yes.
is it okay to drink alcohol? How much is too much? Are certain types better than others?
Well, so alcohol increases risk for cancer. We know that. Okay, this is another one of the things that's like processed meat. And the recommendation is limit alcohol. Or I think at one point the American Institute for Cancer Research said if you don't drink alcohol, don't start. So that's always my line. If you're not somebody who drinks alcohol, we do not recommend you start drinking alcohol. If you're somebody who does drink alcohol, the official definition of moderation from most health groups is not to exceed 1 drink a day for women, 2 drinks a day for men. That's like average ABV or alcohol by volume in 5 ounces of wine, or a 12-ounce beer, or like 1.5 ounces of liquor. So some of the beers are very high ABV, which means it's more like 2 drinks. And some of the wines are really high, or if you have a glass that's larger than 5 ounces, which if you haven't measured that, for those who drink, it's depressingly small. So anyway, yes, alcohol is an increased risk for cancer kind of thing. So you have to decide as an individual, or you work with your patient for them to decide, is alcohol bring joy to my life to the point where it's helping me meet my life goals, whatever, socializing with friends, and you assume they are able to consume alcohol in a way that's not destructive to their life. I think that's another important line there, is if they're doing it in a responsible way, can they find moderation that works for them? If people are wanting to reduce the risk of alcohol, but it is like a social thing for them, there's lots of things you can do. You can find the lower alcohol by volume drinks. So you can find the beers that are lower ABV. You can drink less of them. So if you usually have 2 drinks, maybe you just have 1 drink. I often am somebody who's like, I require myself to drink a glass of water before, I do it before I have my coffee. I do it before I have a drink. And lucky for many of us right now, like non-alcoholic beers and wines are very popular. It's a trend right now that I think is actually a healthy trend. And so I found that there are non-alcoholic beers that taste pretty good. And so I just encourage people to think about that. What are their goals? What is alcohol function? Does it serve in your life? Can you get that from a non-alcoholic? Can you get that from drinking less of it? Do you only drink it once a week, or is it an everyday thing? So it kind of comes down to that piece of figuring out moderation.
Julie, I think the suggestion of drinking water before your coffee or before your alcoholic beverage is a really helpful suggestion. The other thing that I always suggest that people do, instead of having a short glass mixed drink or cocktail, ask them to put it in a tall glass, because then they're using more ice, they're using more mixer instead of more alcohol, and then you can sip on it longer, because a lot of the times you just really want something to hold or something to sip on.
Yes.
So I think that's another really easy way for patients, if they're looking to just reduce how many drinks that they're having in total, is another really helpful thing.
I had a survivor who realized she didn't need the alcohol. She just liked drinking things out of fancy glasses. So in place of her wine, she just got water and a lime wedge and drank it out of her wine glasses. And that was the experience she was looking for. It wasn't the alcohol itself. It was just the experience of using the fancy glasses.
Oh, I love that. And I
That's
actually think that is pretty common for women. We like the fruity drinks with the cute glass. I think that is actually really smart of this young woman to figure that out. So that's a good suggestion, Dane, for your female or male and gentlemen who like the fancy glasses and fancy drinks. So that's really interesting. Julie, quick question about wine. Is white wine or red wine more protective, or does it really not matter?
Doesn't matter. I mean, even the Heart Association, they took away that recommendation around red wine. I always tell people, well, the red wine got the recommendation because the resveratrol, which is this plant nutrient that's in the skins of the red grapes. And I guess white wine, they don't use the skins. And red wine, they do. I don't know a lot about wine making, but someone told me that. Okay. But it turns out you can eat grapes and get the resveratrol. You don't have to drink the wine. So there we have it. It doesn't matter.
All right, Dane, what's your next question?
All right. So CBD, THC is getting big these days. Is it safe to ingest CBD and THC? Will any of these products increase the risk of cancer?
So it's a very complicated question, mostly because it feels like the complete Wild West in terms of regulation. So my biggest concern with these products is that you have no idea what you're getting. Nutritional supplements are not regulated the same way food is regulated. And so it is very difficult to know what you're getting. And so my biggest concern for people is that they get a product that's contaminated with something that is harmful to them, and you have no idea what you're getting. So the data is not super strong on whether there's a benefit to these things. There is data in terms of appetite stimulation for people in treatment. I just typically do not, from a survivorship and wellness standpoint, those are not things that I recommend. If somebody feels confident in the source that they are getting it from, I treat it similarly to how I treat other nutritional supplements or herbals that people want to try. I don't often recommend them. I usually tell people they're better off finding foods and that would be beneficial to them. But if they really want to try it, I recommend that they figure out what is it they're going for, what is it that they want out of this particular product, and they need to track that and give it time. If their medical team doesn't have concerns about them using it, then that needs to be a trial where they are measuring some objective outcome to see if it's helpful. And then if it's not busting their budget and it's helpful and it's not harming them, okay, I'm not opposed to that. But I do have a lot of concerns about the possibilities of contamination or things being in there that you have no idea are in there, because I think it's a major profit-making business right now, and that is problematic.
So I want to move from foods to weight. A lot of patients coming out of treatment, some of them have lost quite a bit of weight, or they've lost a little bit. Some of them, certain treatments, they gain weight, or they come in overweight or obese. So how important is it for these patients to stay within the recommended BMI category?
I think that BMI is a useful tool for clinicians and the worst thing for patients because, it wasn't designed for individual recommendations. It's designed for evaluating the health of a population as a marker, one marker of many. So I don't like using BMI as a discussion point with patients directly. Now, patients come in concerned about their weight, and the healthcare system is a little obsessed with weight as a health status outcome, but I don't think it's appropriate to use as an outcome measure. I think what we want is for people to make behavior changes and choices around behavior that nourishes their body and promotes their health and well-being. And there are a lot of factors that go into what someone's weight is that are largely out of our control. And on top of that, one of the largest drivers of weight gain is people following diets because they go on, then they go off, they mess up their metabolism, they undernourish themselves, they overnourish themselves, and their body is like, what's going on? And that contributes to weight gain. And so I don't use scales in my practice. I don't measure weight as a feedback mechanism to know whether, aside from obviously in oncology, if you lose too much weight, we need you to eat more. But from a long-term perspective, some people will need to put on weight. But when it comes to, are they overweight? I don't use that as an outcome measure. I look at, are you eating fruits and vegetables? Are you being physically active? How do you feel? Is your energy good? Because there's just a lot of things that happen to people during treatment, post-treatment, that affects their weight that is out of their control. And they already have a lot of feelings about their weight and their self-worth that helping to sort of lower that anxiety. I think for a lot of those people, getting their activity levels back and regaining muscle mass, of course, it does require enough protein intake, but I think the physical activity piece is actually priority number one. But I say the same for people who maybe gained weight during treatment who feel like they're not at a healthy weight. We can't just prescribe what their healthy weight is. And so I encourage them to allow their body to figure out what their healthy weight is by nourishing it appropriately, by being physically active, by doing things that help to build that muscle, which they may need a referral to like a trainer or a physical therapist or somebody who can help assess, like, have you lost a lot of muscle during treatment that you didn't realize? And what do you need to help your functional status and then to move into that phase of being active regularly again?
It's a big topic. And as a clinician, we are very hyper-focused on weight, and BMI has been kind of our only metric to measure their outcomes and measure, are you eating enough? Are you gaining weight? Did your BMI go up? Or the opposite, have you lost weight? Did your BMI come down into the quote healthy range? So I actually did an entire podcast episode on BMI called Beyond BMI. If any of you guys wanted to dig a little bit deeper into that topic, and I talked about why BMI isn't a great metric and some other things that you can measure. You can find that on episode 31. Some institutions do have like the higher level bioimpedance analysis machine. So really the patient can just step on and it can give you a pretty decent determination of what their body is composed of between fat and lean muscle. And I think that's a really great metric if it's within the budget. The other thing that you can do that's really great, especially if we are dealing with maybe an overweight or a person with obesity, is measuring their waist circumference. That is a great thing to measure. And it's not their pant size. It is actually the circumference around their belly button, not where their pants rest. And a lot of people are shocked with what their waist circumference is because they thought their pants were, a 36 all along. And then come to find out, no, your waist circumference is actually a 44, So that's a really good one if the patient's comfortable with it and you're worrying about like an overweight obesity picture, because that's something that you can measure. And if they are actively trying to lose weight, you'll see that waist circumference go down. And that can be a metric that you can measure, but also a success that the patient can celebrate when they do meet that.
I know you don't want to just focus on weight, which I totally agree. I think you have to think about the whole picture. But it's hard for patients to grasp that. And there are some patients that really want to focus on the weight because it's all about what can they control. And so in the past few years, we see a huge interest in GLP-1 medications to help with weight loss. So my question is, how do you feel about these new medications that are out there that patients are wanting to get? What are your thoughts on in the scene of cancer survivors? Is this safe to consider? Or is there disadvantages? Are there harms with it?
Like my initial response is like, is it necessary? Number one, like, have we already done other things? Number two, have we assessed their relationship with food? Because we don't need to just throw something on when that's not the root. If the root problem is a relationship with food, medication's not going to fix that. So I do worry about how it might affect or exacerbate problems that maybe had presented in treatment. Partly like, okay, did somebody develop diabetes or have they developed heart disease, or like, are there clinical things that have happened since they got their cancer diagnosis that the patient may not have been educated on because they were in the middle of treatment? So if like diabetes is a new thing, they need to do diabetes education, which is covered by insurance, and there are programs, and I wouldn't want them to jump on medicine prior to accessing all of the tools that lifestyle would have to offer.
I think that's an important piece to end on too, is whether it's a cancer patient or not, these GLP-1 medications, time and time again, the suggestions are showing that you need to have the nutrition education piece in place with this medication, because it's just another tool that's in the toolbox to help patients lose weight. It doesn't replace healthy eating. It's just another tool that a patient can use in conjunction with proper nutrition. And so I think it's probably going to be about the same for any oncology patients as well too, that getting that core foundation of nutrition, knowledge, and education is really important first and foremost.
Right.
I think I'm going to give up. I can't stop Julie. She was all knowing. I surrender. You are amazing. Thank you so much. This has been great.
Dane, thank you so much for your time. And Julie, I appreciate your wisdom and everything that you answered for us today. This has been so fun. Dane, if you have more questions that come up, we're more than happy to have Julie come on. And guys, if you have any questions and you would like to be featured on the podcast, go ahead and look in the show notes and you can fill out that form down below. I would love to have you featured. Guys, thank you so much for being here, and I appreciate the gift of your time.
Thank you so much.
Thank you, Colleen.
Well, that's it for today, my friend. I really hope you enjoyed this new format, and be on the lookout for our next episode of Ask the Dietitian. As always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.